Kristen here at UT Southwestern Medical Center. Today I'm joined with Cynthia Griffith. Cynthia is a physician assistant in our Department of Dermatology. I'm very excited because she's also a graduate of the UT Southwestern School of Health Professions. She's certified by the National Commission on Certification of Physician Assistants and the Texas State Board of Physician Assistant Examiners and specializes in general dermatology. Even better, in 2017, she was awarded our 2017 Physician Assistant of the Year. So we're going to be talking about winter skincare relief. If you live here in North Texas, it's cold for us outside, and so I'm excited to have Cynthia with us today.
Thanks for having me.
Yeah, no, so let's get right into the conversation. We'll take as many questions as we can get to as normal. And just to get us started, how often should you wash your face in the winter?
So one important thing to think about, especially with cleansers and washing your face in the winter, is you want to make sure that you're using a cleanser that says for gentle skin or for sensitive skin. So sometimes cleansers that are exfoliating, like scrubs, or cleansers that are salicylic acid based or geared towards acne, they can be a little bit drying during the winter. So if you use one of those, you may want to use it a little less frequently during the winter, especially if you're dealing with dry skin on your face, so itchy faces, patches on your face. You may want to put that cleanser aside and use something that says for gentle or sensitive skin, just a gentle cleanser when you wash your face. And it's okay to wash your face morning and evening, especially if you're wearing makeup to wash your face in the evening, but trying to make sure that you're not necessarily using hot water, but more warm water when you're washing your face after you've used your gentle cleanser. And then also making sure if you use any exfoliating brushes or washcloths or loofahs or anything like that, especially if you're struggling with this dry skin this winter, that you really kind of take a break from those, because aggressive exfoliation with those things can sometimes make you more prone to having dry or itchy skin. And then also if you're exfoliating over active acne, then that can make you more prone to scarring. So really just washing your face with your hands and a gentle cleanser, something that says for gentle or sensitive skin, and warm but not hot water once or twice a day, once in the morning and then in the evening after you are ready, when you're ready to take off your makeup during the winter time.
Okay, great way to get started. So what about, are there specific ingredients that people should look for, and do they differ this time of year, or is it consistent throughout the year?
Yeah, so on any products, first off, if you have dry skin or prone to dry or sensitive skin in the winter or all year round, looking for products that say they're for ultra gentle or for sensitive skin. So those are going to be products that don't contain a lot of topical antibiotics. So some products like Dial, Lever 2000, Crest, Irish Spring, Ivory, sometimes they're more antibacterial, and those are going to be a little bit more drying to the skin. So in general, if it says antibacterial, that's going to be more drying than if a product says for gentle skin or for sensitive skin. So what you're changing there is you're switching out. You don't have those products like benzoyl peroxide or salicylic acid that are good if you're acne prone, but they're not going to be great if you have sensitive skin or if you're struggling with dryness this time of year.
Okay, good to know. So we're starting to get questions in. Definitely submit as many as you have. We're going to start with one from Crystal, and her question is, do you recommend any oils? I've heard some people might use them at night, or some people do use them at night.
So sometimes there can be different oils, and they're used for different purposes. So in general, if you have issues with sensitive skin, we want to kind of be careful about what you're putting on your skin, because you can be more likely to break out. So definitely sometimes certain oils, look at the ingredients on the back of the oil, and if there's a lot of ingredients, that's going to make me a little bit more concerned that you might be sensitized, potentially if you have dry or sensitive skin, to one of those ingredients. So, but if you keep it really simple and you want to try one and see if you like it, sometimes I even tell people you can put a little bit on a part that's maybe not your face, like the inside of your arm, and then give it about a week. So you put it on for a week, kind of do your own experiment and see if you tolerate that well and it doesn't cause any redness or irritation, then you're probably safe to use it. But also your kiddo is a little bit different from you, so something that you use on yourself, your kiddo might have a little bit more sensitive skin or might react to things differently, so you would want to just take that into consideration.
Okay, really great question,
Great
Crystal.
question, yeah.
Thanks for getting us started. Here's one from Lindsay, and I understand Lindsay completely. She says, there are so many things we're supposed to use on our face. Is there a specific order that I need to use my skincare? Like moisturizer, sunscreen, facial oil?
Yeah, okay, that's a great question. So you want to start out with a cleansed face. So first off, you're going to cleanse your face. Then the next thing that I typically tell people you're using things from lightest to heaviest. So with one exception. So you want to use a moisturizer. So if you have a serum that you apply, so after a cleansing you would do a serum because that's typically going to be about the lightest thing that you're going to put on. During the day, a lot of people will use maybe a serum that has an antioxidant, and that would be reasonable because in the day you're going to be potentially going outside, dealing with pollution, dealing with smog in the city. So the point of an antioxidant serum is to kind of combat that. So you use that during the day, and then you're going to use a moisturizer. And the moisturizer you want to put on, and then you want to use your sunscreen. Sometimes people will, in the evenings, use a retinol or retin-A or containing product, and you want to put that on moisturized skin. So again, in the evening, we're kind of do the same thing. You'd use a cleanser. If you want to use something that's a serum, you would put it on at this step, and then you would use a moisturizer, and then put your retinol or retin-A or topical vitamin A containing product on your skin.
Okay.
If you were going to do it in.
Great question. Thank you.
Question.
Yeah, here's one from Lori Hamilton, and it's, what do you recommend for dry, chapped lips?
That's a great question. So it's a super common thing this time of year that people have dry, chapped lips. So I like a petroleum-based product. So Aquaphor is a good one. They also make Aquaphor that has sunscreen. But you could use an Aquaphor, which is essentially like a Vaseline. But the key is you have to use it throughout the day. So our lips are like our cuticles. They come in contact with everything in the world throughout the day, so they will get dry. So I tell people carry it with you and then put it on before and after meals and then at night. So you're going to be using it 3 or 4 times throughout the day. And you want to ideally try to do it before your lips are so chapped that they're painful, because it's hard to come back from that at this point in time. But starting this like in September would be great, so that when we get to now, our lips are well hydrated. And you can use, like I said, any petroleum-based product, but I like Aquaphor, or just petroleum jelly that you would carry with you and then just apply throughout the day to your lips. Sometimes people also need to apply it in their nostrils, because if you're getting clots when you blow your nose, or you're prone to nosebleeds, it may be because just like your lips can get dry, the inside of your nostrils can get really dry, and then especially with kiddos, sometimes that makes them more prone to nosebleeds and things. So you can take a Q-tip, and you don't have to go high into the nostril, like if you've ever had one of those uncomfortable strep tests. You're not going up. You're literally just going right inside the nostrils with your Vaseline at night or before and after. And it may make you sneeze, and that's okay. Then you just wipe with a Kleenex and you just go about your day. You don't need to put it back in. But moisturization sometimes needs to happen there, especially if you are prone to nosebleeds. And sometimes people will do nasal saline rinses, which also can help to hydrate that nasal mucosa that sometimes will get dry. But you'll know if you're dry because you'll be prone to nosebleeds, or you'll be seeing clots when you are blowing your nose.
Okay,
so that would be the only people that would necessarily need to be doing that.
So I see a lot of people using lip gloss and saying they put stuff on their lips. Is there anything to that?
Yeah, so it depends, again, looking at those ingredients and seeing if there's petroleum in your gloss that you're using. Sometimes those glosses, they might not be as hydrating. And then another thing that I like to do with my petroleum-based lip is also put it around your cuticles. After you're doing it, put it, because the cuticles of your fingers can get very dry and then cracked, prone to then becoming ragged, and then that makes you more prone to infection around the nail. So they need to be moisturized, and the best thing to use would be something thick like you're going to use on your lips to put that around the cuticles.
Okay.
And trying to leave the cuticles in place rather than clipping them back, because those cuticles are the first line of defense. We don't want them to be gone, because then bacteria can get from the environment in, and it can make us more prone to having an infection around the nail.
Wow, I didn't realize that. It's a great question.
Yeah.
We got a couple here. We've got one from Lori and then one from Lindsay. We're going to start with the one from Lori. And her question is, do you recommend a humidifier, warm or cool setting?
Yeah, so humidifiers are great, especially if you're dealing with dry skin. That's actually the mechanism by which we get more dry in the wintertime, is that there's not as much humidity in the air. So especially if you or your kiddo are struggling with dryness, really dry skin, a humidifier in the bedroom would be perfect. So yes on the humidifier.
Okay.
To put it at night for you or your your kiddos if you're struggling with dry skin.
Okay. And the setting, warm or cool, that doesn't matter necessarily?
Yeah, no. So either whatever you find most comfortable, whichever one you like, but turning it on and having it on there would be good.
Okay.
Yeah.
Great question, Lori.
Yeah, great question.
Thanks for joining us. So we're going to take one from Lindsay, and this is an interesting one. And she asks, is there or should there be a difference between women's and men's facial care during the winter? Can I moisturize my husband the same way I moisturize?
That's a great question. That's a fun question. So typically ladies are willing to put more and do more than gentlemen, just a general statement. So if you wanted to make sure of kind of the bare bones of what maybe your spouse might be needing to do, washing with a gentle cleanser versus making sure that he doesn't have something that says for acne prone skin, using a daily facial moisturizer, and maybe you do a 2-in-1 that has sunscreen and facial moisturizer. So CeraVe, Cetaphil, Eucerin, different of these products, they have kind of the 2-in-1, so it's sunscreen and moisturizer. So you could do that, and that would kind of combine steps if it's the kind of thing where the person may or may not only put on kind of one thing. So that a combo product like that might be good. But anything that shouldn't be used, both in general, your spouse could use any of the products that you use. The only thing that I say is, and it's more the other direction, men to women, is anything that is retinol or retin-A containing. Differin is an over-the-counter retin-A or vitamin A, and that is not going to be recommended to be used while women are pregnant or breastfeeding. So your retin-A containing product would not be, it's not approved for pregnant or breastfeeding women to use. But other than that, all of your products that you use, your spouse could use as well. Yeah.
Really great question, Lindsay.
Great, fun question, yeah.
Yeah, that's important. So here's a great one from Ellen, and this is I think a pretty common one. But what should I do when my face starts breaking out? And does what you need to do vary because of the weather?
Yeah. So when your face is breaking out, which can happen even when we're in the winter time, you may want to, so one, you want to make sure, like we've kind of said before, and that you're not aggressively exfoliating mechanically over those areas, like with a loofah or washcloth. You want to kind of step back with that, because doing that aggressively over acne lesions can make you more prone to have those scar and pigment on you. So darken, which we don't want to do. But that might be a time where you might want to reintroduce that acne face wash that you use. For women that are not pregnant, or men You can use a topical vitamin A containing product, like we've talked about, a retinol or retin A containing product. Differin, it was a prescription, but now it's available over the counter.
Okay.
So that would be an option for you if you're not already using prescription strength retinol and you're having breakout issues. But the issue is with starting it at this time of year, you're going to want to use just a little bit, and you're going to want to space it out over. So maybe you touch the end of the tube and touch the 4 quadrants of your face and rub it in twice a week. So you're because if you put it on and you put it on like a lotion all over your face, then you're going to notice that you're very dry. So, but a topical retinol like Differin that's available without a prescription would be a reasonable place to start if you're having issues with breakouts.
Okay, sounds good. We've got lots more questions coming in. This is great. This is an interesting question from Crystal, and that is, how do you determine an allergic reaction from dry skin, especially in your lip area?
So lips can be tough because you can get an infection around your lips because of the bacteria that normally lives on our skin, normally lives on our mouth. You can have an irritant reaction, which is a reaction that anyone would get, like to an acid-containing product, like if you have had a lot of pineapple juice and then you start to have a reaction on your lips, or you can be allergic to a product that you have. And so sometimes we kind of recommend, in general, coming in and kind of getting an evaluation if you're having trouble kind of parsing that out, and gentle care. So taking a break from everything that you're using for 2 weeks and maybe just using something very bland like Vaseline on your lips. If that doesn't help and you're still having those issues and they're not getting better, because an allergic reaction, if you stop coming in contact with that over the time span of about a month, that's going to kind of decrease. So if you've kind of taken a break from your products and you're still having the issue, maybe we might need to tease out, is there something else going on?
Okay, that's a good question. Thanks for bringing it up. So here's another one, and this is a follow-up from Crystal. But do you recommend taking supplements for skin, hair, and nails?
Yeah. So there are a lot of supplements out there. One of the main ones is a biotin supplement for skin, hair, and nails. And the only things that we think about are with biotin. Sometimes, especially if you have issues with your thyroid, or you can, if you're taking high doses of biotin, it can sometimes affect those thyroid tests. So just kind of think about that. If you are taking supplements of biotin and you have issues with your thyroid, you might just want to talk to your doctor and make sure, especially if your doctor's checking your labs, because it might have some abnormalities in your labs. But in general, a biotin supplement, especially if you're having issues with that, wouldn't be a bad idea. It's actually best for nails. It's not as beneficial for hair. Yeah.
Interesting.
So if your main issue is hair, I wouldn't do it. But if the issue is really your nails, then a low dose biotin supplement would be reasonable. For hair, it would be, the treatment that I would recommend over the counter would be minoxidil, which comes in a foam or solution. It's also marketed as Rogaine, but minoxidil and that would be the most beneficial thing for hair, as far as it's a topical that you would put on. So that's going to be more beneficial than taking a hair or nail supplement orally.
Okay, good to know. So what about, this time of the year, we talked about humidifiers and, washing your face and how often you should do it. How often should you be moisturizing? And I'm not just thinking about your face, but your whole body.
Yes, yeah. So that's a great point. So also, for the same as far as cleansers for your face, we want to make sure that you're not drying out your body by using an antibacterial body wash or soap on your body. And then the best time to apply a moisturizer would be right after you get out of the shower, when your skin is actually still a little bit damp. So you're going to pat dry, and then you put on your moisturizer. And if you're struggling with dryness, you're going to want something that's a little bit thicker. So a cream versus a lotion. So you want a cream that comes in a tub or a tube, rather than a lotion is going to come in a pump bottle. And if you're at the point where you're dealing with dry, itchy skin, then you're going to need a cream, especially in the wintertime, versus a lotion that's going to come in a pump. And you want to do it every time after you get out of the shower, or at least once or twice a day for your whole body if you're dealing with dryness. But the most important time is going to be when you get out of the shower to kind of help moisturize that skin.
Good to know. So what about, just to touch back on that, I mean, what about people who have traditionally oily skin?
Yeah.
Should they be moisturizing that often as well?
So you do need a daily moisturizer, even if you are more prone to oily skin. But if you're a person that's more prone to oily skin, a lotion might be a good pick for you. Or now they have, like I know Neutrogena has one that's more of a gel cream that has a lighter consistency, and that might be a better way for you to go if you tend to be more prone to oily skin. And then I tell people you're not necessarily in one of the two categories. You might have areas that are more prone to oiliness and areas that are more prone to dryness, even on your face. So a lot of people tend to have oily areas and then more dry areas, and it's okay. You don't have to use the same product or the same cream or lotion everywhere on your face. If you tend to have areas that are more dry, maybe putting a thicker product like a cream there, and then areas that tend to be a little bit more oily may use a lotion there. So you don't have to treat your whole body or your whole face exactly the same.
Okay, great. So we've got probably about 5 minutes left, so now's a great time to submit those last minute questions. I did want to follow up on what you just said. Why do you, in those cases, do you want to use a cream instead of a lotion? What are the differences there?
Yeah, so in many cases, there is a cream, and then to be able to pump it out of the lotion pump, they've essentially thinned it with like an alcohol-containing product. So the alcohol can be dehydrating to your skin. So a lotion is going to not be as hydrating as something that's a cream. Or sometimes they haven't used alcohol, but they've used water. So essentially, the cream is the more concentrated version, and then the lotion is a little bit more dilute with a product that contains either water or alcohol. So lotions are not bad, but if you are having an issue with dryness at this point in time, a cream might be the way to go. And then a lot of people switch to a lotion in summer when they're not needing as much, and a cream might feel a little bit too thick for them. So then feel free to skip to a lotion that comes out of a pump.
Right, because it's thinner than, okay.
Yep.
That
And your
makes
skin
sense.
is naturally a little more oily in the summer, especially here. We're sweating a little bit more. We're a little more.
A lot more.
That's right. So yeah, then a lotion would be a reasonable bet.
Okay, great to know. So we've got time for, I think, 2 more questions. Here's one from Lindsay, and thank you for sticking with us. This is a great chat. Her questions are, what are your thoughts on face masks for moisture in the winter?
Yeah. So again, you want to check the labels and the ingredients. You don't really want to use anything that is, if you're struggling with dryness, you don't want to use anything at this point that is necessarily an exfoliating mask, a charcoal mask, a type of scrub mask. You would want to really stick with a hydrating mask. And you would want to look at the ingredients and make sure there's not alcohol in the mask. And then if you're someone that's dealing with allergic reactions or sensitivity, then you would want to probably not go the mask route. You would probably want to stick with a hydrating cream. But masks would be a reasonable thing, but if you're struggling with dryness, you want to stick with something that says hydrating. You really don't want to use, so charcoal masks, acne masks, scrubs, those are going to be more exfoliating, which at this point in time is going to make you more prone to dryness. It's going to be a little bit more for if you are oily and you're trying to sort of be a little bit less oily. So, great question.
Yeah, great question. I see a lot of charcoal masks everywhere, so that's not the thing to do this time of year.
Right. Yeah. So that would be more if you're in general talking about people that are more acne prone and are trying to. They're typically marketed toward acne prone, but I would recommend if you have limited funds or you're going to spend your money on one thing, that you're doing more like a different gel that's available over the counter, because that's going to actually do more for you over time than using these masks, because acne tends to be a cyclical thing. You tend to have it over time, so doing a mask once isn't going to give you as much benefit as something like using a retinol a couple times a week.
Okay, good question. So last question, this one's from Ellen, and this is one that I've heard kind of talked in my female friend circle, and it's, do jade quartz or rose quartz rollers have any effect on your skin?
Yeah. So I think the idea behind those is really trying to increase circulation to the areas, increase lymphatic circulation, but actually circulation to your face is pretty awesome. Your face has a lot of blood supply going to it, and you're doing a lot of that when you apply your products. So when you're putting on your sunscreen, or you're doing a lot of that. So if you for some reason want to do it and you feel like it's something that is relaxing to you or beneficial to you, probably more the relaxing component is probably doing more for you than, because you're actually doing that when you are putting your products on. And if you want to make a point to kind of continue to massage your face and kind of when you're cleansing your face, you're essentially doing a very similar thing, increasing blood flow and lymphatics to your face. Yeah.
Okay, interesting. Well, thanks for the question.
A cool. If it relaxes you, then it's worth it.
The relaxation is good for the skin.
That's right, for sure.
All right, well, we are all out of time. I want to thank everybody who tuned in for all the great questions. This is going to be here on Facebook, and it'll also be on our YouTube channel later today, and we'll share the links with everyone so you can invite those who weren't able to attend. But in the meantime, thank you for joining us, and thank you very much, Cynthia. This has been really informative.
Thanks for having me.
Absolutely.